Hello, everyone. Welcome to Medicaid and a Healthier Oklahoma, presented by the CoverOK Coalition. And I'm really thrilled that you could join us today. I'm Carly Putnam, the Policy Director and Recovering Healthcare Policy Analyst with Oklahoma Policy Institute, a nonprofit, nonpartisan public policy think tank and advocacy organization based in Tulsa. We're one of more than 20 members of CoverOK, Oklahoma's Medicaid Advocacy Coalition. And today I and the representatives from a number of other coalition organizations will be talking a bit about Medicaid expansion and what it means for the Oklahomans who will get coverage as a result. Before we get to the good stuff, we've got a little bit of housekeeping. Firstly, the default Zoom view may mean that our shining faces cut off a portion of the slides, and you can adjust that by clicking the view button in the upper right-hand corner. Also, this webinar is being recorded. The recording should be available later. Exactly when or how is dependent on the tech gremlins and what it takes to appease them. As I think Dana noted, we will have time for questions at the end. You can submit them through the Q&A box down at the bottom of the screen. I can't promise that we will get to everyone's question, but we will do our best. And also, please do bear with any tech issues we may have with patience and good humor. Hopefully, we will all be successful in unmuting ourselves on the first try, and no one's router will blip at the wrong moment, but we may not be that lucky. So with that out of the way, here's who you'll be hearing from today. Myself, Dana Bacon with the Leukemia Lymphoma Society, Charlie Gagan with the American Lung Association, Whitney Sipola with Mental Health Association of Oklahoma, and Cindy Alexander of Indivisible Stillwater. Next slide, please. We decided to do this webinar because the struggle to get Medicaid expansion in Oklahoma really isn't over. We were all overjoyed when the ballot measure passed this summer, but passing State Question 802 was really only the first step in making sure that hundreds of thousands of Oklahomans can get the health care that they've been waiting for, and the health care that they would have if they lived in more than 30 other states. There are going to be a lot of really weedy, really technical discussions at the state capitol and the state Medicaid agency this year about the nuts and bolts of expansion. But fundamentally, Medicaid expansion isn't about the technicalities and it isn't about the acronyms, it's about the people. And so that's what we'll be talking about today. The road that got us here, what Medicaid expansion means for Oklahomans, what happens next to get those Oklahomans the health care that they need, and most importantly, because the legislative session is right around the corner, how you can help make sure that that happens. And so with that, I am delighted to hand it off to Dana Bacon.
Thanks, Carly. Hi, I'm Dana Bacon with the Leukemia and Lymphoma Society. I'd like to tell you a little bit about what Medicaid does, why we have expansion, what's been going on with it, and tell you about State Question 802. So Medicaid was established back in 1965 at the same time that Medicare was created. Medicaid is the public's primary health insurance program for low-income people, retirees, children and families, and people with certain disabilities. Roughly 1 in 5 Americans is covered by Medicaid. Medicaid programs are managed by states. There's some local flexibility. For example, state programs have to cover a minimum set of health benefits, and they may expand these benefits as decided. Medicaid's paid for with state and federal dollars. All states are guaranteed at least $1 from the federal government for every dollar they spend. In the case of Oklahoma, for every dollar the state spends on Medicaid, federal government sends a bit more than $2. So it's a really cost-effective opportunity for Oklahoma to take care of the folks I described. Medicaid's a program that's proven to be really responsive to community needs, to changing demographics, and responsive to public health crises. And that's something that I know has been on a lot of minds for many months with COVID-19. Medicaid expansion was designed to be a core component of the Affordable Care Act, and it's meant to help close the coverage gap for America's working poor. That can include people working for low pay without employer benefits, or seniors nearing retirement who've lost their jobs and healthcare coverage. For example, we're talking about individuals earning less than $17,000 a year, or a family of 3 earning less than $29,000 a year. If you're earning more than this, it's not Medicaid expansion you're looking at. You're looking at subsidies to help people buy insurance on the private market. But all in all, a Medicaid expansion is part of this flow of options to provide coverage in different ways at different levels. Congress created a carrot when the Affordable Care Act was passed. The carrot is we'll pay for 90% of the costs of expanding Medicaid. The stick at the time was if you don't expand Medicaid, we're going to end your federal Medicaid funding. In 2012, however, the Supreme Court ruled that that stick, the defunding, was unconstitutional. This basically made Medicaid expansion an optional feature for states. You can look at this map to the right and see what we mean now by optional. State Question 802 last June showed that Oklahoma citizens wanted to expand Medicaid expansion. A majority of Oklahomans voted yes, and as of today, 38 states plus the District of Columbia have expanded Medicaid or are in the process of getting Medicaid set up. Thanks to State Question 802, around 200,000 Oklahomans will now have access to affordable comprehensive health coverage. Our job as advocates, as we're going to hear throughout this presentation, is to work with state elected officials to get the funding for Medicaid expansion set up. So with that, we're going to hear more about what Medicaid means to Oklahomans, and I'd like to introduce Charlie Gagan with the American Lung Association.
Thank you, Dana. Again, my name is Charlie Gagan. I'm the Advocacy Director for the American Lung Association of Oklahoma. I'm excited to talk to you all today and really drill down on what Medicaid means for Oklahomans. So next slide. Right off the top, Medicaid expansion, there are 200,000 newly eligible Oklahomans who are eligible for Medicaid expansion. These 200,000 Oklahomans will have increased access to primary care, leading to better health outcomes overall. It will also lead to greater financial stability and a higher labor force participation rates for that expansion population. Another benefit would be fewer uninsured children. There are a variety of benefits to both individuals, providers, as well as the economy. When we look at providers, Medicaid expansion allows for reductions in uncompensated care, greater financial stability for community health centers, and what we've seen in states that have expanded Medicaid is better financial performance for those hospitals, particularly safety net and rural hospitals. When we look at the benefits of Medicaid expansion to the state economy, what we know is that an ongoing investment of about $1 billion annually from the federal government in the first year will have a wide variety of positive outcomes on the economy. It's estimated that in just the first year that money from the federal government will lead to $2.5 billion in new state revenue, 17,000 new jobs, and nearly $1 billion in new labor income. This new revenue, new jobs, and new labor income would touch every county in Oklahoma, as every county would be participating in Medicaid expansion. Medicaid expansion will also reduce uninsurance rates through the state and support those rural and hospitals and their economies. What we've seen in expansion states is that the uninsured rate can drop by up to 19 percentage points, with the difference being slightly different in more rural and urban areas. But we know that very low income patients will receive better access to things like asthma treatment, mammograms, substance abuse treatment, and a variety of other positive health opportunities. Hospitals can also contribute as much as 20% of rural economies and are often the top employers in communities. Expansion will give these more rural hospitals better financial footing and better performance, therefore decreasing the likelihood that they might close in the future. Next slide. So what does Medicaid expansion do for racial health equity? What we've seen in numerous studies in the states that have expanded Medicaid is that expansion helps reduce racial health disparities, and you can see some of that in these charts. Oklahomans of color generally have higher rates of uninsurance due to certain systemic and historical factors, with the uninsurance rate among both Hispanics and American Indians roughly double that of whites, and Black Oklahomans also have a higher rate of uninsurance. Due to these variety of factors, people of color are more likely to report fair or poor health outcomes, more likely to face certain health issues like higher rates of asthma, diabetes, and heart disease. And so we really believe that Medicaid expansion is a great opportunity to begin the work towards a more equitable health outcomes for all Oklahomans. Next slide. Medicaid expansion has a huge impact for those Oklahomans with chronic diseases, either who already have chronic diseases or might, someday be diagnosed with one. The variety of things that work are better access to preventative services. What we know with many types of, particularly types of cancer, is that the sooner you can screen and receive those screening and preventative services, the better your health outcomes are, the more likely you are to have a good experience with your chronic disease. We also know that the more affordable access to care, folks are more likely to go to a primary care doctor regularly. And overall, what we've seen is that, particularly in states that have expanded Medicaid, patients with newly diagnosed breast, colorectal, lung cancer have a decreased mortality due to Medicaid expansion. Next slide. Medicaid expansion also has led to an increased coverage for veterans across the country. While many veterans do have access to VA healthcare, not all do, and Medicaid can serve as a great kind of safety net and supplemental coverage for veterans who might have a gap in their coverage, who might need some sort of supplemental care. So it really does provide another layer of safety net for those Oklahomans who have served our country. Next, I'll pass it over to my colleague Whitney, who will talk a little bit more about what Medicaid expansion means for Oklahomans.
Thanks, Charlie. I am Whitney Sapola. I'm the advocacy specialist with Mental Health Association, Oklahoma, and we have some information for more specialized populations and how expansion will impact them. So what does this mean for tribal members? Linda Capps, Vice Chairman of Citizen Potawatomi Nation, says Medicaid expansion will positively impact the tribe since more than 40% of their patients are uninsured. Expansion will help reduce the cost burden of purchased or referred care, which will allow CPN to assist more patients and improve the quality of care for services not available in-house. Next slide, please. For many people with intellectual and developmental disabilities, Medicaid is generally the only source of funds for them to live and work in the community with friends and family and avoid more costly and segregated nursing homes or institutions. Medicaid is critical for folks with disabilities who may not have access to employer-based or private coverage, but who have greater medical needs and often require assistance for daily living throughout their lifetimes. Expansion also makes it more likely that parents and caregivers can get the health care they need as well. Next slide. For people experiencing homelessness, they often have higher rates of chronic and behavioral health issues. Expansion is linked to increased coverage rates and better access to care. This leads to fewer hospitalizations, reduced opioid overdose deaths, and increased access to preventative care and prescription drugs. These positive changes, in turn, support the ability of people to maintain work and stable housing. Next slide. And then what does it mean for Oklahomans with mental health? Before the Affordable Care Act, which expanded eligibility through Medicaid expansion, there was no standard pathway to Medicaid coverage for adults with mental illness unless they were pregnant, elderly, or had been determined to have a disability. Expanding eligibility based on income removes barriers to coverage, including more than 92,000 Oklahomans living with mental illness who are uninsured. Next slide. Medicaid coverage of mental health services is often more comprehensive than private insurance coverage because the ACA mandates that Medicaid expansion plans cover 10 essential health benefits, including mental health and prescription drugs. There is also evidence that among non-elderly adults with any mental illness or a serious mental illness, those with Medicaid are more likely than those without insurance or without any insurance or without private insurance to receive treatment. Next slide, and I'll pass it back to Carly.
Hey, thanks, Whitney. Carly Putnam, back again. So in order for Oklahoma to realize the gains that Whitney and Charlie have just outlined to the fullest extent possible, there's a couple of things that need to happen. The first is that the state legislature needs to fund the state share. They need to fund it fully, and they need to fund it appropriately. We know that we're going into another budget shortfall, which is kind of a very familiar territory for Oklahoma. And we know that some legislators have suggested that the only way for Medicaid expansion to happen is to cut elsewhere. And that's not the case. When Oklahomans voted to pass State Question 802, they didn't vote to trade childcare for Medicaid expansion, or to trade TSET for Medicaid expansion, or to trade provider rate cuts for Medicaid expansion. And the legislature has a lot of options when it comes to pay for Medicaid expansion. The state Medicaid agency, the Oklahoma Health Care Authority, and the legislature also need to finalize enrollment dates. So coverage is expected to begin on July 1st, and most states have opened up enrollment well in advance of the date that coverage takes effect, so that providers and enrollment systems aren't completely overwhelmed on day one. Next slide, please. And then finally, there's sort of the managed care question. The OHCA has proposed and is in the process of finalizing plans to transition the majority of Oklahoma's Medicaid population over to commercial managed care 90 days after Medicaid expansion takes effect. This proposal has raised a lot of questions from Oklahoma's providers and advocacy groups. And so we're watching this implementation really carefully to make sure that state dollars are spent wisely and that potential savings don't come from harmful cuts and reductions to care. Either way, Medicaid expansion will be in effect July 1 of 2021, and that is a massive cause for celebration. And now Cindy Alexander of Indivisible is going to talk about how you can get involved.
Thanks, Carly. I'm Cindy Alexander with Indivisible Stillwater. This webinar has highlighted the value and the importance of upcoming Medicaid expansion. We worked really hard to get State Question 802 passed, but our work is not done. Now we must work hard to ensure that Medicaid expansion becomes the best plan possible. Specifically, that the implementation is patient-focused and delivers essential and comprehensive coverage without administrative barriers. Lawmakers need our energy and support as they design the expansion. Our Constitution now requires that the expansion population be covered under Sonicare by July 1st of this year. That is only 6 months away, so now is the time to reach out to those elected to serve. If you visit CoverOK.org and click on the word action, you'll be taken to a button where you can click and find your legislator. Put in your address and see your legislators. Click on Find Out More under their name, and you'll see their official website as well as their phone number, mailing address, and a link you can use to send an email. And if you click in the chat box, you'll see the sign up link for CoverOK.org. When communicating with your legislator or their aide, it is always important to identify yourself as a constituent, include your contact information, briefly describe your background or situation. For example, are you unable to afford insurance? Are you a healthcare provider? Have you been helped by Medicaid? Be polite, be succinct, ask for what you want. Don't forget to ask. For example, I am asking the representative to fund Medicaid without cutting other important programs, and ask for a reply. You might say, I look forward to your reply, or a courtesy of a reply is expected. Next slide, please. While the most effective way to communicate with your legislator is face-to-face, that may not be the best option under current circumstances. Standard letters sent by mail will take more time, but can be carefully developed to include more information and perhaps be more persuasive. Emails are more promptly delivered and may be more promptly read. If you send an email, be sure to ask for a reply and follow up by phone if one is not forthcoming. Phone calls have certain advantages. A flood of calls lets an office know what topic is important to constituents, and it is harder to ignore a flood of phone calls than a flood of emails. Generally, a phone call will result in immediate engagement with your legislator's staff. Prepare for your phone call by making a cheat sheet so you don't forget anything, and use the tips identified earlier. Identify yourself, briefly describe your background or situation, be polite and succinct, and ask for what you want. In addition to what's on this slide, here's some additional talking points. Medicaid expansion is good not only for those covered, but for the economy and for rural hospitals. The state knows how to provide high quality Medicaid coverage in a cost-efficient manner. It has been doing so for years. The funding of Medicaid expansion is an investment in communities and citizens. Medicaid can be funded without cutting other programs or raising taxes. And there'll be another link pop up in the chat box for you soon where you can read more about that. Communicating with your legislator is important, and your advocacy can make a difference. Now back to Carly.
Hey, thank you, Cindy. Yeah, the line that our outreach folks have used is that it's not a question of whether you know who your legislators are, but do your legislators know who you are? And setting yourself up as a resource and a familiar face or voice or return address on a letter for folks who are hired to represent us. And so it looks like we do have a few minutes for questions. So again, please drop any questions that you have in the Q&A box. We may not be able to get to every question, but we will certainly do our best. Here's one. With legislators asking about funding core services this session, some legislators are claiming that funding Medicaid may impact legislators' ability to fund core services, and what is the best response to this claim? Exactly what the best response is going to depend a lot on your organization and what specifically you're working for. But the short answer is that lawmakers have significant options to pull revenue from other sources. I believe Dana had dropped a link in the chat where my colleagues Emma Morris and Paul Shin had identified upwards of $600 million in funding possibilities that could be brought over to cover state share, which is $160 million, without raising revenues or cutting core services. I'm not saying that those would be easy decisions for lawmakers to make, but they're options that lawmakers have, and they should absolutely be encouraged to explore. Someone says, I thought the legislature had a plan to fund the governor's plan for Medicaid during last session. Is there a reason that plan wouldn't work now? Yes and no. So there was a funding option available last session, but the plan that was on the table didn't include managed care, which could change some of the nuts and bolts of the funding priorities there. So legislators definitely still have options. They just may not be exactly the same options that they had identified last time. Another question, will these talking points be on your website and available to us? Yeah, if you can go to coverok.org, you'll see them there. Also, if you go to a number of the websites of the organizations that are coalition members, we definitely have those as well. So question, is there a possibility with managed care implementation that it can turn into a Medicaid HMO where members are restricted to in-network providers? Short answer is basically yes, without getting too deeply into the weeds. And that can be one of the concerns, is that especially in rural areas, that networks can wind up being remarkably narrow and not leaving people with a ton of choices. Managed care in and of itself, I want to be very clear, is essentially neutral. It's neither good nor bad. It just depends on how it's implemented and what sort of measures the state takes to make sure that the care that's available is the care that people need. And here's a question. What exactly does this cover and who? That is a surprisingly broad question. Medicaid expansion should cover working age adults, which is people age 19 to 64, who are earning below 138% of the federal poverty level. And Dana threw out the specific numbers earlier there. Medicaid also covers a lot of other people. It covers a lot of kids. It covers people with some disabilities. It covers some low-income elderly folks. The primary group who should be getting access to care through this is going to be working age, low-income adults. A lot of them will be parents whose kids have been covered by Medicaid for a while, but the parents themselves have not been. And many will be single adults who work in jobs that simply do not actually offer health coverage. It's also, then here's a question. Are undocumented Oklahomans eligible to participate in Medicaid expansion? They absolutely are not. No, they aren't. Will Native Americans be given a special provision to opt out of these HMO plans, or is it a one and done type plan where they have the option to pick a PPO? I wish I had an answer for you, but I also want to mention, as long as people are asking these questions, that the state Medicaid agency has a ton of information available about this and should be discussing it in upcoming meetings. And so signing up for alerts on their website and directing these questions to them, and if you're getting answers that aren't the answer you want, explaining why you would like a different one. It's a really important part of the advocacy process here. There are federal requirements for the state for transparency and for the state to get and receive, or to ask for and receive feedback from the public as they're going through this process. And so having folks engaged on this is a really big issue. I believe the next state Medicaid agency board meeting is on next Wednesday, I think. And if you've never tuned in before, definitely do so. They're a surprising amount of fun. Let's see, do I have other questions? Are there any better programs to assist special need parents or family for many disabled children and adults? And can legislators consider looking into other states that have successful programs for special needs? This actually touches on a really important point, and it's again, this is an question that doesn't have a super simple answer. Medicaid expansion isn't a silver bullet. There are a ton of issues with access to care, particularly for people with really complex disabilities, and Medicaid expansion will not immediately, instantaneously be a fix for that. It often does mean for parents or caregivers who have had to stop working or significantly reduce their hours and thus don't have access to insurance through an employer, Medicaid expansion is a great way for those folks to get access to care, to both take care of themselves and to take care of the folks that they work with. That said, Medicaid expansion won't fix every single problem. And so making sure that we're talking about this as part of a suite of other issues for state legislators to address is really important, and making sure that legislators aren't going to say Medicaid expansion didn't fix everything and therefore the program was a failure. We can't expect that, but we can expect a lot of good to come from it. Here's a question. Are there specific pieces of proposed Medicaid funding legislation on the table that advocates need to reference with representatives? Not quite yet. The legislative session doesn't kick off for another 2 weeks, not that we are counting down. And so loads and loads of bills are still being filed. But all of the organizations that are part of this webinar will be monitoring that very closely and letting advocates know as this stuff begins to happen and as we begin becoming active on bills. Also, CoverOK.org, you can sign up to get advocacy alerts and information from us so that we can help tip you off when those pieces are happening. It's also worth noting a complicated part of sort of the uniquely Oklahoman legislative experience is that the budget and things that fund the budget the budget and what it funds are often sorted out towards the very end of session, usually in the last few weeks. And so a lot of options can still be on the table right up through the very end. And so keeping an eye, making sure legislators are hearing from us all the way through session instead of only at the beginning or only at the end is really, really important. And here's a question, what's the state's objection to expanding Medicaid? It's not, the state really doesn't. And to be honest, it doesn't matter if the state does or not. With State Question 802 passing, Medicaid expansion is the law of the land in Oklahoma. There's, I think, mostly just differences of opinion in how it ought to be done. The running joke among Medicaid advocates is that if you've seen 50 state Medicaid programs, you've seen 50 state Medicaid programs. Every state does it very, very differently. States have a lot of options. And so the states, the advocates have a lot of ways for making sure that the program that their state is developing is the one that fits their needs. So, and again, to stay plugged into all of this, which is absolutely a lot, a couple of requests. One is to go to coverok.org to sign up to get more information, and also to contact your legislators and letting them know that we want to pay for Medicaid expansion without cutting other core services, and that we want to have a Medicaid expansion that works best for the people who will be enrolling in it. Medicaid expansion, I know, is still controversial, but lawmakers, but it has passed, and it's up to lawmakers to implement it. Fundamentally, their job, on top of everything else that they do, the core of their job really is to make sure that they are funding the public's priorities, and Oklahomans have indicated that this is their priority. The experiences of 30+ other states show that the results are pretty remarkable. Let me check with my co-conspirators here to see if there are any other questions we need to grab. And if you've been wondering about submitting one and you hadn't decided, now would be the time. We are just at 4:35.
We do have a question. Will Medicaid expansion bring in Medicaid buy-in?
Not automatically. It's an option that I think still is pretty far down the road. One does not automatically trigger the other. And if I have gotten that wrong, so one of my co-conspirators stop me, because that's an issue I haven't worked on for a really long time. Putting an emphasis on rural areas makes a lot of sense. Adult senior care is not just for the non-working adults, but a subsidy for employers in low-wage industries or employers who mostly prefer to use part-time employees. Yeah, that's correct. Even in a lot of areas where there are jobs, the jobs may not pay enough, or the people working those jobs may only be working part-time. There's sort of a frequent misconception that Medicaid is for people who don't work. And I think all of us who are active in making sure folks have access to healthcare know that people work. It's just a matter of, can they get the jobs that they need? And can they get the healthcare that they need that will allow them to then better support themselves and their families? Here's a question. Are there specific legislators that would be beneficial for us to talk to and develop relationships with in regards to having more favorable outcomes? The most important legislator to talk to is going to be your own. Those are the folks that are going to be most influenced by you, because you and a lot of other people around you are the ones who essentially hire them for their jobs and decide how long they're there. And it is their job to represent you and your interests.